Hello and happy Friday. Now, with the opiate crisis, of course, we've become very mindful of different ways that we can use to control pain after surgery or at least support patient experience. And the cosmetic world's no different. So today I thought I would share with you some of the tips or tricks that we use here when patients go through cosmetic surgery. Now, the first one, of course, is to use something in the non-opiate category. So things like ibuprofen or Tylenol. We prefer Tylenol first, but ibuprofen actually still is very helpful either in and of itself or in a kind of an alternating fashion where you use Tylenol and then ibuprofen kind of sequentially. Now, Tylenol itself is fine pre and post surgery, but ibuprofen tends to make patients bleed a little bit more. It tends to make us fear that they're going to bleed a little more with surgery or bruise more with surgery. So we really are focused on using that only in the post-operative phase. Now, there are other medications that seem to help in that category. So we actually use arnica or Arnica montana. And that's an herb that's used in a homeopathic version where we also get patients started on that pre-op, so they tend to get less bruising with the surgery. But there is also anti-inflammatory qualities to it as well. In some cases, some of the studies used it to actually control things like dental pain after extraction. So we do know that there's some pain modulating effects of that as well. Similarly, although Madison or Wisconsin is not a legal state for THC use, patients who've had experience or have access to THC and CBD also seem to have a better experience with surgery, where they actually either can relax a little bit or it might modulate some of the pain as well, but it seems to kind of keep the experience just a little bit easier. And so if you have access to that, that's another possibility. A little bit of pre-planning goes a long way. So if you talk about getting meals set up beforehand, and meals specifically that are typically soft, so there's not a lot of chewing, and I talk about this because of facelifts. A lot of times with facelifting, their jaws are sore. They don't like to open their mouth really very wide in the beginning, and it loosens up. But in the beginning, if you have softer meals, that makes that easier. But the preparation of that lets you kind of focus on your recovery as opposed to preparing meals at that time. And the other one is there's some studies that have suggested that a higher protein content in your food during recovery is also valuable. And of course, we always want you to eat well, drink a lot of fluid, for example. So raw fruits and vegetables obviously are very good. Again, big fans of smoothies around here because those do well and you can pack those with tons of protein so you can get both good nutrition and a good protein load at the same time. The other thing that is always kind of questionable is patients talk about whether collagen has value or not. And again, our diets are not typically depleted or deficient in collagen, but the idea of doing some collagen supplementation leading up to the surgery is not a bad idea as well, and especially considering some of these collagen proteins and their availability in the commercial world makes them a good idea as well. Now, we always talk about ice. And the idea of using ice in the very beginning of surgery, especially in the first 72 hours after surgery, has a great deal of value. And what we find is that it's not necessarily that consistent icing that makes a difference because, again, we actually fear, let's say in a facelift, that there's some numbness to an area. You can get some frostbite to there. But it's the pulsatile quality of the ice that seems to make a difference. Some people saying no more than 15 or 20 minutes at a time. And again, a lot of the research or the studies have shown that it's the reperfusion that happens. It's not the ice, it's the blood supply that is returning to try to warm up the tissue that makes a difference. Now, blood supply, of course, during healing is your friend. It's perhaps one of the most important part. So the idea of getting that reperfusion to bring in new nutrients and take away some of those evil humors that are in areas of healing should actually improve both the healing speed as well as the comfort and therefore the pain. So those are all valuable as well. Similarly, gentle massage seems to help to mobilize some of those areas of fluid. And again, with less fluid, less swelling comes less pressure, and with less pressure comes less pain. And so massage seems to be really valuable as well. So those are areas are all that we think are very helpful. So being involved, doing some simple steps, taking care of yourself, doing a little pre-planning goes a long way if you're ever considering a cosmetic surgery and trying to minimize the pain afterwards.